Well, the city's first batch of swine flu vaccines have arrived this week, and there's still more to come. In the coming weeks, dozens of clinics in low-income areas will also be equipped to handle the swine flu crisis. City Council Speaker Christine Quinn is here to tell us more about how the city is preparing. Good to see you this morning.
Good morning.
So there are about 70 clinics that have been prepared especially for the swine flu.
Well, actually, what happened a number of years ago after September 11th, we all got together and said, how do we make sure our whole healthcare system is ready for any emergency? So we put in place emergency preparedness training, which we then adapted for the swine flu. So 70 clinics in low-income neighborhoods, 2,000 healthcare professionals have been particularly trained on how to deal with the swine flu and on emergency preparedness. 18 of those clinics are going to distribute the vaccine, but all will be ready to help people. And this is particularly important because we want to make sure that low-income, uninsured people know there are vaccines and care out there for them as well.
So they can get the shot for free?
Absolutely,
okay.
Absolutely. And in the first week in November, we'll have a listing of those 18 clinics. But since so many clinics has been trained, if they go in a clinic in their neighborhood, they're very likely to see trained professionals who can refer them where to go.
And at this point, you cannot get the vaccine?
No, people should not go to the emergency room or to the clinic. We've had real problems with people overwhelming clinics looking for the vaccine. It's not there yet. These 18 will have it the first week in November, and we will get that info out to people so they know where to go.
Now, there are reports today, I forget which paper I was reading since I read them all this morning, but one of them said that maybe the city, people in the city are immune to the swine flu because we've already been exposed to it. Your reaction?
I mean, that is a theory some medical professionals are putting out. Others, doctors and scientists are saying that could be true, but we won't know. Remember, last year the swine flu hit hardest at the end of regular flu season in the springtime. So people need to consult with your doctor. If your doctor says you need to get the swine flu vaccine, you need to get it. If you're uninsured and don't have a regular doctor, go to a clinic in your neighborhood. They've been specially trained, and they'll help you decide if you or your children or family need the vaccine.
Beautiful. Okay, let's talk about what other things are in front of the City Council right now. This parking ticket amnesty. I am particularly interested in this.
As all New Yorkers.
Only because, just maybe a month ago, my daughter was sitting in the car when we got a ticket.
Right.
So tell me what the City Council is thinking about this, and the mayor.
Well, the mayor has put out a proposal to kind of make parking and paying your meter, etc., all electronic. So you could do it from your phone, your BlackBerry, your iPhone, that kind of a thing, which will hopefully decrease people's amount of tickets that they're getting. We're looking at doing things like putting a 5-minute grace period. So if your meter's up at 11, you have till 11:05.
That would be nice.
And make common sense, right?
Yes.
And then make it not a gotcha. Because the thing is, tickets and fines aren't supposed to be revenue generating or gotchas. They're supposed to remind us to follow the rules and the laws. And sometimes I think we forget that. We're also looking at requirements when there are changes in parking regs to make sure neighborhoods and merchants know about that earlier, because that's really a way people park where they may have parked for months, and then they come out and they get a ticket.